What if your body has been sending you warning signs for years and you've been completely ignoring them? Most women are told high cholesterol has no symptoms, but here's what cardiologists aren't always explaining. Your body is speaking. The question is, do you know its language? Here is something that should stop you in your tracks right now. Nearly 45% of American women over the age of 20 have high cholesterol, nearly half, and the overwhelming majority of them have absolutely no idea. They are going about their daily lives, working, raising families, taking care of everyone else around them, completely unaware that something dangerous is quietly building inside their arteries. And this is not just an American problem. In the UK, over half of all adults have raised cholesterol levels. In Australia, it affects 1 in 3 women. In Canada and across Europe, the numbers tell the same alarming story. So why don't more women know about this? Because for decades, heart disease and high cholesterol were considered a man's problem. Medical research was primarily conducted on male patients. Symptoms were defined based on how men experienced them. And women were largely left out of the conversation. The result? Women are diagnosed later, treated less aggressively, and are more likely to die from a first heart attack than men. That is not a scare tactic. That is a documented, peer-reviewed medical reality published by the American Heart Association. But here is the good news, and this is important. You are watching this video right now, which means you are already ahead of the curve. By the time this video ends, you are going to know the 9 warning signs that your body may already be showing you. Why women's cholesterol behaves completely differently from men's, and exactly what steps you can take starting today to protect your heart. Stay with me, because some of what I'm about to share is going to genuinely surprise you, including a warning sign that has nothing to do with symptoms at all. Before we get into the warning signs, we need to talk about something that most health videos completely skip over, and that is the biology behind why women and men experience high cholesterol so differently. Because once you understand this, everything else we discuss today is going to make so much more sense. Let's start with the basics. Cholesterol is not your enemy. In fact, your body cannot survive without it. Your liver produces cholesterol every single day because your body uses it to build cell membranes, produce hormones like estrogen and testosterone, and support brain function. The problem is not cholesterol itself. The problem is when certain types of cholesterol build up in places they should not be. Think of your arteries like smooth, flexible pipes. When you have too much of the wrong type of cholesterol circulating in your blood, it starts to stick to the walls of those pipes, building up into a thick, waxy deposit called plaque. Over time, that plaque narrows the pipes, restricts blood flow, hardens the artery walls, and eventually, if left unchecked, can trigger a heart attack or stroke. That is the simplest, most accurate way to understand what high cholesterol actually does to your body. Now, you have probably heard the terms LDL and HDL. LDL is often called the bad cholesterol, and HDL is called the good cholesterol. LDL is the type that deposits plaque onto your artery walls. HDL, on the other hand, actually helps carry excess cholesterol back to the liver, where it can be broken down and removed from the body. Then there are triglycerides, a type of fat in the blood that is closely linked to diet, and which, in women specifically, is a stronger predictor of cardiovascular risk than it is in men. This is something many doctors do not emphasize enough, and it is a detail that could genuinely save your life. Now here is where it gets really important, and really unfair, honestly. Women have a natural biological advantage when it comes to cholesterol, but only up to a certain point. Estrogen, the primary female sex hormone, actually helps keep LDL levels lower and HDL levels higher. This is why, for most of their reproductive years, women tend to have better cholesterol profiles than men of the same age. Estrogen is essentially acting as a protective shield around your cardiovascular system. But then comes menopause. And when estrogen levels drop, that protective shield disappears almost overnight. LDL levels surge, HDL levels fall, triglycerides climb, and suddenly, women who had perfectly healthy cholesterol their entire adult lives find themselves at serious cardiovascular risk within just a few years of menopause. This is why women in their 50s and 60s actually overtake men in their LDL levels, and why postmenopausal women are one of the highest risk groups for heart disease on the planet. And it is not just menopause. Hormonal birth control can raise LDL and triglycerides in some women. Pregnancy causes a natural and significant rise in cholesterol that does not always return to pre-pregnancy levels afterward. Women with polycystic ovary syndrome, PCOS, are at significantly elevated risk of abnormal cholesterol, often from a very young age. And thyroid disorders, which affect women at a rate 5 to 8 times higher than men, directly interfere with the body's ability to regulate cholesterol. This is a hormone story as much as it is a cholesterol story, and every woman deserves to know it. Before we move on, let me bust a myth that I hear constantly. People believe that if their total cholesterol number looks fine on a blood test, they have nothing to worry about. This is dangerously incorrect. Your total cholesterol number is just the starting point. What actually matters is your ratio of LDL to HDL, your triglyceride levels, and increasingly, markers like lipoprotein A or LPA, which is a genetic form of cholesterol that standard panels often do not even test for, and which is disproportionately common in women of African and South Asian descent. A number alone does not tell your full story, and if your doctor has only ever told you your total number without breaking it down, it may be time to ask for more. Now we get to the heart of everything, no pun intended, the 9 warning signs that women most commonly overlook, dismiss, or misattribute to something else entirely. And I want you to take this seriously, because several of these signs are things that women are actively told are normal, are age-related, or are connected to stress. Some of them are, but some of them are not. And knowing the difference could genuinely change the course of your life. Warning sign number 1, xanthomas, the skin signal nobody talks about. This is one of the most visually obvious signs of high cholesterol, and yet it is consistently missed because most people, and even some general practitioners, do not immediately recognize what they are looking at. Xanthomas are small, yellowish, slightly raised deposits of cholesterol that accumulate under the skin. When they appear on or around the eyelids, they are specifically called xanthelasma. Small yellowish patches near the inner corners of the eyes that look a little like aging skin or discoloration. They can also appear on the elbows, knees, knuckles, and along the Achilles tendon at the back of the heel, where they can feel like firm, rubbery lumps. Women often mistake these for benign cysts, age spots, or fatty tissue. They are not dangerous in isolation, but they are a direct, visible manifestation of excess cholesterol in the bloodstream. If you notice any unusual yellow deposits on your skin, particularly around your eyes, do not wait. Get a full lipid panel done as soon as possible. Warning sign number 2, corneal arcus, the clue hidden in your eyes. This one genuinely shocks most people when they hear it. High cholesterol can actually be visible in your eyes, not just in skin around them, but in the eye itself. Corneal arcus is the name for a gray or white arc or ring that forms around the outer edge of the iris, the colored part of your eye. In older women, especially those over 60, some degree of corneal arcus can be a normal part of aging. But if you are under 45 and this ring starts to appear, it is a significant red flag for elevated cholesterol and lipid disorders that should be investigated immediately. Here is the powerful practical takeaway from this sign. Your optometrist or eye doctor may spot cholesterol-related changes in your eyes before your GP ever orders a blood test. This is why annual eye exams are not just about your vision. They are a window into your cardiovascular health. The eyes, as they say, are the window to more than just the soul. Warning. Sign number 3, unexplained fatigue and brain fog. This is one of the most widely experienced and most widely dismissed symptoms in women. You feel exhausted even after a full night's sleep. You cannot think clearly. You walk into a room and forget why you were there. You feel like you are operating at 70% capacity for no obvious reason. We chalk it up to stress, to being busy, to perimenopause, to not eating well enough. And sometimes that is exactly what it is. But chronic, unexplained fatigue and persistent brain fog can also be signs that reduced blood flow, caused by narrowing arteries lined with cholesterol plaque, is affecting how efficiently oxygen and nutrients reach your brain and muscles. What makes this particularly concerning is that these symptoms overlap almost perfectly with depression and anxiety. Studies have shown that women experiencing early cardiovascular compromise are frequently treated for mental health conditions first, with their physical cardiovascular risk going uninvestigated for months or even years. If you have been managing fatigue or brain fog without resolution, it is worth having a full lipid panel as part of your investigation, not just a thyroid check or a mental health screening. Warning sign number 4. Chest discomfort, but not like you think. When most people imagine a heart attack, they picture a dramatic crushing chest pain, the kind you see in movies, a man clutching his chest and collapsing. But here is what the research actually shows. Women experience heart attack symptoms very differently, and chest discomfort in women is far more likely to present as a dull ache, a feeling of pressure or tightness, a sense of something being not quite right in the chest, rather than an acute, severe, unmistakable pain. Women are also significantly more likely than men to experience pain or discomfort in the jaw, neck, upper back, or left shoulder as part of a cardiac event. And critically, women are more likely to have their cardiac symptoms dismissed or minimized in emergency settings. Studies published in the Journal of the American Heart Association found that women waited significantly longer to receive treatment for heart attacks in emergency departments than men with the same severity of symptoms. This is not just a medical issue, it is a systemic issue. And the most powerful tool you have against it is knowledge. Know your symptoms. Advocate for yourself. If something feels wrong with your body, you have every right to insist on being fully evaluated. Warning. Sign number 5. Shortness of breath. During normal activities, when your arteries become progressively narrower due to plaque buildup, your heart has to work harder to pump the same volume of blood around your body. Over time, this increased workload can manifest as breathlessness that seems disproportionate to the activity you are doing, climbing one flight of stairs and feeling winded, walking briskly from the car park to the supermarket and needing to pause, feeling breathless during a conversation when you are not physically exerting yourself at all. Now, breathlessness has many causes: low iron, asthma, being deconditioned from inactivity, even anxiety. But if you notice that your breathlessness has appeared recently, is getting progressively worse, or occurs during activities that never used to wind you, do not normalize it. That change is your body trying to get your attention. Listen to it. Warning for number 6, leg pain, cramps, and peripheral artery disease. High cholesterol does not only affect the arteries around your heart, it affects every artery in your body, including those that supply blood to your legs. When plaque builds up in the peripheral arteries, the arteries in the legs, it causes a condition called peripheral artery disease, or PAD, and PAD is dramatically underdiagnosed in women. The classic symptom of PAD is a cramping, aching, or tired feeling in the calf muscles that comes on when walking and disappears within a few minutes of resting. This is called claudication. But women with PAD are more likely than men to experience atypical symptoms, like aching in the thigh, buttock or foot, slow healing wounds on the lower legs or feet, coldness or numbness in one leg, or a noticeable color change in the skin of the lower legs. PAD is not just a quality of life issue, it is a serious marker of systemic cardiovascular disease. Women with PAD have a significantly elevated risk of heart attack and stroke. If any of these leg symptoms sound familiar, this needs to be on your radar and in your conversation with your doctor. Warning sign. Number 7. Sudden headaches or mini-stroke symptoms. A transient ischemic attack, commonly called a TIA or a mini-stroke, occurs when blood flow to part of the brain is temporarily interrupted, often by a small clot or a piece of arterial plaque. Symptoms can include sudden confusion, difficulty speaking or understanding speech, temporary vision changes in one or both eyes, dizziness, loss of balance, or a brief weakness or numbness on one side of the face or body. Critically, these symptoms resolve within minutes to hours, which is exactly why they are so often dismissed. Women are far more likely than men to attribute TIA symptoms to a migraine, to exhaustion, or to stress, and to wait before seeking medical attention. This is one of the most dangerous delays in medicine, because a TIA is a medical emergency and a powerful warning that a full stroke may follow. High cholesterol is a primary contributor to the plaque formation that causes TIAs. If you or someone you love experiences any sudden neurological symptom, even briefly, call emergency services immediately. Do not wait to see if it happens again. Warning sign. Number 8. High blood pressure that refuses to respond to treatment. This one is critically underappreciated. Many women are prescribed blood pressure medication, take it faithfully, and still struggle to get their blood pressure under consistent control. One significant but frequently overlooked reason for treatment, resistant hypertension, is unaddressed high cholesterol. When your arteries are stiffened and narrowed by plaque, your heart must generate more pressure to force blood through them. Treating the pressure alone, without addressing the underlying cholesterol causing the arterial stiffness, is like trying to unclog a pipe by adjusting the tap. You are treating the symptom, not the cause. If your blood pressure has been difficult to manage despite medication and lifestyle changes, ask your doctor specifically about a full lipid panels, including LDL, HDL, triglycerides, and if possible, LPA. The two conditions are deeply intertwined, and managing one without the other dramatically limits your results. Warning sign number 9, and this is perhaps the most important one: no symptoms at all. Here is the truth that makes high cholesterol so uniquely dangerous, and why I saved it for last. The most common warning sign of high cholesterol is the complete and total absence of any warning sign whatsoever. The majority of women with dangerously elevated cholesterol feel completely, perfectly, entirely fine. They have energy, they sleep well, they exercise, they eat reasonably, and inside their arteries, plaque is quietly accumulating, year after year, without a single signal being sent to the conscious mind. This is why the phrase, "I feel fine, so I must be fine," is one of the most medically dangerous sentences in the English language. Feeling fine is not the same as being healthy. Silence is not safety. It is simply the absence of a warning. And for high cholesterol, the first symptom for far too many women is a heart attack or stroke that seemingly comes out of nowhere. Routine testing is not optional. It is essential. It is the only reliable way to know what is actually happening inside your cardiovascular system. Now that you know the warning signs, let us talk about what actually causes cholesterol to become dangerously elevated in women. Because some of these risk factors are going to genuinely surprise you, and several of them have nothing to do with diet. Menopause and perimenopause, as we discussed, represent one of the highest risk transitions in a woman's cardiovascular life. But the risk actually begins rising during perimenopause, the years before your periods stop completely, which means women in their early to mid-40s may already be experiencing cholesterol shifts without realizing it. Regular monitoring in the years leading up to menopause is not just reasonable, it is medically justified. Genetics plays a far larger role than most people realize. Familial hypercholesterolemia, or FH, is an inherited condition that causes extremely high LDL from birth, regardless of diet or lifestyle. It affects approximately 1 in every 250 people, is significantly underdiagnosed in women, and dramatically increases the risk of early heart disease. If a parent or sibling had a heart attack before the age of 55, or if you have consistently high cholesterol despite a healthy lifestyle, FH should be specifically investigated. Diet and lifestyle absolutely matter, but perhaps not in the way you have been told. Dietary cholesterol from foods like eggs has far less impact on blood cholesterol than saturated fat and trans fat consumption. The biggest dietary drivers of high LDL are processed foods, red and processed meats, full-fat dairy products, commercially baked goods, and ultra-processed snacks. Meanwhile, a sedentary lifestyle, chronic psychological stress, poor sleep, smoking, and excessive alcohol consumption all independently raise LDL and lower HDL. These are modifiable factors, meaning you can change them. And every small change compounds over time into significant cardiovascular protection. So what do you actually do with all of this information? Here is the practical action plan, based on current guidance from leading cardiovascular health organizations. First, get tested, and get tested comprehensively. Current guidelines recommend that women have their cholesterol checked at least every 5 years from the age of 20. But if you have any risk factors, family history, PCOS, thyroid issues, diabetes, previous pregnancy complications like preeclampsia, or you are approaching menopause, annual testing is more appropriate. Ask your doctor for a full fasting lipid panel and specifically request your LDL, HDL triglycerides, and your non-HDL cholesterol. If you have persistent high cholesterol or a family history of early heart disease, ask about LPAA testing as well. Second, know your numbers, not just your verdict. Do not let a doctor tell you your cholesterol is a bit high and leave it at that. Ask for the specific numbers. Ask what your LDL target should be given your individual risk profile. Ask about your cardiovascular risk score. You are entitled to a full, informed understanding of your own health data. Third, make the lifestyle changes that actually move the needle. Increase your intake of soluble fiber, found in oats, lentils, beans, apples, and flaxseed, because soluble fiber physically binds to cholesterol in the digestive tract and helps remove it from the body. Increase omega-3 fatty acids through oily fish, walnuts, and flaxseed, which specifically help lower triglycerides. Move your body consistently. Even 30 minutes of brisk walking 5 days a week has been shown to meaningfully raise HDL. Quit smoking if you smoke. Limit alcohol. Prioritize sleep because poor sleep independently raises LDL and triglycerides. Fourth, have an open, informed conversation with your doctor about medication if it is appropriate. Statins are among the most studied medications in history and are highly effective at lowering LDL. They are not right for every woman, but the decision should be made based on your individual risk profile, not on outdated assumptions or media-driven fear. If statins are not suitable for you, there are excellent alternatives, including ezetimibe, PCSK9 inhibitors, and bile acid sequestrants. The conversation is worth having. And fifth, advocate for yourself relentlessly. If your symptoms are dismissed, seek a second opinion. If your cholesterol has been flagged but you have received no follow-up plan, push for one. If you are told you are too young to worry about heart disease, know that heart disease does not check your ID before it develops. You know your body better than anyone. Trust that knowledge, and do not stop until you have the answers and the care that you deserve. Here's what I want you to carry with you long after this video ends. High cholesterol in women is common, it is serious, it is frequently missed, and it is almost always manageable when caught early. The warning signs your body sends are subtle. Easy to explain away and completely easy to overlook, unless you know exactly what you are looking for. Now you do. The 9 signs we covered today, from the skin deposits and the eye changes, to the fatigue, the breathlessness, the leg pain, the blood pressure issues, and the most important sign of all, no sign at all. These are your body's way of communicating with you. Your job is to listen, to act, and to take your cardiovascular health as seriously as you take every other responsibility in your life. You cannot pour from an empty cup, and you cannot care for anyone else if your heart is not cared for first. So please, book that appointment. Get that blood test, have that conversation. Share this video with a woman in your life who needs to hear it, because the information we covered today could genuinely save a life. It might even be yours.